Greetings, fellow Homo sapiens, and welcome to the Symbiotic podcast. For this episode, we teamed up with Penn State students Matthew Ogden and Matt Paolisi from the podcast Podward State, launched by the popular student blog Onward State. Along with Matthew and Matt, we hosted two guests. Meg Small is a research associate in the Bennett Pierce Prevention Research Center for the Promotion of Human Development at Penn State and director of the Health and Human Development Design for Innovation Lab. And Connie Rogers, also from Penn State, is an associate professor of nutritional sciences and associate director of the Huck Institutes of the Life Sciences. Meg and Connie are key faculty researchers collaborating on a project called Data for Action, an effort to understand the impacts of COVID-19 on the population of Centre County, Pennsylvania, from many perspectives, including physical and mental health, economics, and behavior. The Data for Action project is a profoundly collaborative effort involving local government, healthcare facilities, multiple units across the university, and thousands of volunteers from throughout Centre County. I hope you'll enjoy our conversation about this innovative and timely research. Hey, thanks everybody. It's so exciting to be doing this collaborative episode today with Matt and Matt from the Podward State podcast, all Penn State student-run podcast. And our guests today, Meg Small from SSRI and Connie Rogers from our own Huck Institutes. Thanks everybody for being here. So we're here today to talk about the Data for Action research project. So I'm going to let one of our co-hosts from Podward State maybe come in with some early questions for our guests.
Yeah, thanks a lot, Cole. So we can go to Meg real quick. Meg, do you just want to give us like a definition of what the Data for Action project is for someone who might not know anything about it?
Yeah, so of course, thank you for having us and allowing us to sort of share information about this study. It's a complex project. It has three components, but at the heart of it is, when the pandemic started and we realized the depth and the length that this pandemic would take, researchers at Penn State wanted to leverage all the expertise that we had on campus to provide science and evidence to inform the actions that could be taken to help both our community cope and recover from this, as well as our student population and obviously the Penn State community more broadly. So the Data for Action project has three components. We started with this really large Centre County-wide survey that involved over 10,000 community members. From there, we recruited a resident cohort that we're collecting both survey data from, but also biomarker data from. And we're hoping to begin enrollment with a student cohort, again, where we'll collect biomarker data and survey data about the social, behavioral, educational implications of the pandemic. So it's really combining and leveraging lots of different institutes and research traditions on campus, which is sort of exciting that we're able to sort of provide this at this time.
And Meg, could you talk about some of the data that you're collecting when you're surveying everybody in Centre County? What kinds of information are you pulling from them?
Yeah, sure. So for the large, that cross-sectional study of community members, we're looking at sort of their experiences with COVID, symptoms they've had, their mitigation behaviors. So how often do they wear face coverings, wash hands, et cetera. But we're also looking at the economic impacts. So are they employed currently? Have they lost their job or been furloughed since the pandemic began? Or did they own a small business? Is that business still operational? So those are the kinds of things that we're asking about. And then for the cohort study, which is also Centre County community residents, we go much more in depth about the impacts on family dynamics for families with young children. How difficult is it to provide sort of educational opportunities, when the schools completely shut down, and now some, we have a number of school districts within the county. Some are fully open, some are doing a hybrid. A lot of families have chosen to keep kids at home and educate online. So we really want to sort of understand how that's going for them. And then also just the stress, coping, and anxiety that goes along with this pandemic. So a lot of questions about health, well-being, coping strategies, particularly in the student cohort. That's going to be really important to understand sort of the educational implications, but also the stress and anxiety. And as well as the flip side of that, the adaptive coping that students are engaged in.
Thank you.
So how early in the pandemic did this project get started, and how, if at all, has it evolved since it first began?
Yeah, Connie, you were involved in the beginning. I actually reached out to the entire team, which just grows every week. So I'll say just a little bit of what I understand it to be, because I came in, not so late, maybe 3 weeks into the planning, but a lot had already been done. First, I just want to say that the infrastructure that Penn State's invested in allowed us to move really fast and collaborate really effectively. So this started in March, and I think the genesis was a conversation that Nita Barty and Matt Ferrari had about sort of mobility and populations moving, and then the risk for transmission of infectious diseases. And it was clear that there's sort of this stable population in Center County, but that students and visitors and tourists and families move in and out of the county quite regularly. So what would the implication of that mobility be? They then took it to other folks at Huck pretty quickly, and they said, we have the tools to provide some information that could really inform risk and resilience in this population, in this sort of really unique population that we're sitting here in. And then they immediately reached out to Susan McHale, who's the director of the Social Science Research Institute, and said, it's not just the bio on this, it's going to be the social, behavioral, educational, coping, stress, all of the sort of broader impacts. And that's when the social scientists got involved. And then Connie, you were involved pretty early on because of the significant role that the labs were going to play in assaying, right?
Right. And I kind of walk the lane between doing human subjects research and animal research. So my research is very translational. So I was brought in because I had worked really well with the Clinical Research Center on our own research projects, because this involved, getting a group of people who hadn't worked together before to all speak the same language and be very functional. And so it involves the social and behavioral scientists and designing the right kinds of questionnaires. It involves people like me who are involved in clinical studies and also who have a laboratory that can do some of the biospecimen processing and storage.
Right on. Thank you.
And then Matt, how it's changed over time, I think, and I just cannot say enough about two groups of people, the clinical staff, the nurses, and all of the folks that are checking, and a lot of students are volunteering on this project too, checking participants in, really facilitating sort of that bio collection, making everybody comfortable and making sure informed consent is clear. And then all of the students that are working on the back end in the labs as well. I mean, this is just literally a cast of thousands to get these data collected as quickly as we did.
That's wonderful.
I'd like to, just reinforce that we've been really fortunate to have a number of both graduate students, but undergraduates be very interested and become involved in the research process. Because I think many of them have said, I want to do something. I want to do my part. How do I do a better job, or how do I help the university or help the students move forward?
Right on. Hey, Matt P., I'm kicking it back to you.
Sure. Yeah. You guys were talking about student involvement. What are some other ways that students can get involved right now with this project? Maybe whether it's research or not research.
Well, I can answer on the sample end. We have had a lot of students be interested in volunteering to do things like help interview folks when they come in, or help get their informed consent to participate in research. We have folks that are simply serving as couriers. They're helping us shuttle all these complicated biological samples from point A to point B. Some of the folks are working in my lab, and they got the appropriate training. And then we're probably going to need students to help with data analysis. So I think, depending on people's interests, their skills, the time that they have, there's lots of places that they could participate, kind of all along the spectrum of the research going on.
Yeah, and I'll just add to that, that we're, again, like I said, we're hoping to start enrolling students into a cohort, again, same methods that we use with the residents. So we'll need students helping in the clinic to check people in, to do some screening questions, answer questions. It's always really great to have students, helping other students go through the process. And then we have pilot testers for our surveys, which are great because a lot of things that students catch that researchers don't catch, ways that things are worded or ways that items could be misunderstood, even additional sort of variables that need to be included. We've had lots of students help us, and we're going to continue this through the spring. So there'll be at least 3 data collection points. So it's always great to get student input. And make sure that survey has a real student voice to it so that it seems relevant and resonates with students. So we could always use help, people looking over the surveys for us as well. Again, data cleaning on the back end and doing some of the survey work helps a lot too.
And then even just talking about it amongst yourselves, sort of getting folks familiar with what we're doing and why we're trying to do it, that in and of itself goes a long way. To get the word out that this is going on and we need students to participate.
Yeah, let's talk about that for a second, why we're doing this. What is the big picture goal? What are we really trying to accomplish with this study?
Yeah, sure. So I think what we want to do is provide the very best science we can to help the campus and the community through this pandemic. So whether that's actually giving the numbers on what our risk profile and our exposure profile looks like to the virus, or it's helping decision makers both inside the university but also in the community target scarce resources, right? So there's a lot of problems that might be flying under the radar right now. Again, I just, sort of thinking about the 18 to 24-year-olds, we know from national survey data that anxiety, depression are on the increase, but we don't know what it looks like on Penn State's campus. So we really want local data, the highest quality local data we can, to make really informed choices about how we spend our time and our resources, so that we get the very highest level of impact we can to sort of reduce our risk and promote our resilience.
Thank you.
Right. And I don't have too much to add other than, sometimes you think you know what the problem is, but without collecting data that might be unique to a community like Penn State, right? We're a relatively small town without the students, but we have this, this symbiotic relationship with the town and the students. And so I think really getting an understanding of, as Meg said, what are the issues and then how to move forward appropriately based on in the best interests of our community and including all of us.
Thank you. And I understand because I was involved in some of the marketing that we were reaching out to the local mayor and county commissioners and really involving local officials as well who are looking at this data in partnership with Penn State, which is fantastic.
Yeah, we regularly brief council members, mayors, local government, and again, just as an example, and I can share some data here in a minute, but everybody thinks, we haven't had a high level of this virus circulating in the community like over the summer, but now we have numbers to show that actually is the case in the resident community. So we want to continue to monitor that over time. Same with the students. We really don't know what the past exposure to the virus was because so many of our students come from higher prevalence areas or lower prevalence areas. And we just haven't had the capacity to sort of really assess the antibody levels, so the past exposure. I know there's a lot of testing going on right now on campus for live virus, for current infections, but what's the past infection profile look like? I think it's an interesting question, and we'll be able to answer that.
Right, because if people listening don't realize yet, when you participate in the biological sampling aspect of this study, you're giving blood and able to see if you have antibodies in your blood. So you could have no virus in you whatsoever, and maybe you were exposed in the past, you've got antibodies and you don't even know it. And that's something that's part of this study, right?
Mm-hmm.
Mm-hmm.
Meg, do you want to maybe go ahead and share some slides so we could take a look at some of the research and what you've discovered so far?
I'll just quickly talk for a minute about the county survey. This is the cross-sectional, the big survey that we did between June and October. We have a few people that filled this out more recently, but you can see that we actually we're over 10,000 now. We're just sort of still cleaning the data, but that's the number for the sort of all county participants, and then that 1472. Those are the participants that came through and gave us biological samples. So as part of that larger survey, we asked community members, would you like to be enrolled in the cohort, which we're going to follow, like I said, at least for 3 time points over the next year, and give us biomarker specimens, and then also complete a longer survey. So that's the 1472.
Yeah, and so for people just listening who aren't seeing the slides on our audio podcast, we had about over 9,500 as of October 4th, 9,573 of folks who did an online survey about how the pandemic has affected them. And then of those, 1,472 folks came in and gave biological samples for part 2 of the survey.
And it's actually up just a bit from that, but those are right around our final numbers.
Got it.
So here's some of the sort of early results that I mentioned earlier from the folks that gave us the biomarker data. We are at about 2%. So a couple of things about the sample. It's not what we call in public health a purposeful sample. So it's a convenient sample in that we try to get as many participants into that 10-minute survey as possible. And then, but there's still a selection bias of the people that did that survey and then the people that chose to give us information and potentially enroll into the cohort study. So we don't want to misrepresent this as saying, okay, this is definitely representative of the entire community. However, the numbers are such in terms of the number of participants that we have that we're able to sort of look at the demographics of the county and compare that against our participants, which we will be doing. So we're going to say a bit more about how our participants look compared to the county overall. However, from not an insignificant number of people who have come through the clinic, we only saw about 2% having been exposed previously to the virus.
So that's 2% of people who have antibodies in their blood.
Correct. Exactly. So again, I think that the Huck folks would say, we're a pretty naive population, that we haven't had high levels of exposure of the virus through at least September. We had a few folks come in and give blood in October, but for the most part, we were collecting data in August and September.
And Meg, just to clarify things, of that group of people that came in, had any of them known that they had the virus in the past?
Yeah, so we asked that on the survey so we can compare that, but I don't have that exact response. It would be anecdotal if they happen to mention it. So we will be reporting whether or not they had tested positive or, had otherwise had a clinical diagnosis of the virus. So we'll also know if they had symptoms. So we ask about symptoms independent from a positive test result. So that's how we're sort of combining the survey and the antibody data as well. And then just the last, if people are interested in learning more, this is sort of where we are. We're going with the somewhere between 1,000, maybe 1,500 students. And we're right now under IRB review, so we can't say too much about when we're going to launch that, but we're really hoping to do it this month. And again, the same procedures for the students. We'll ask them to enroll. They'll complete. The student survey is a bit shorter. It's about 20 minutes long. And then they'll come into the clinic and give the same specimens. And then we're going to start through late November, December with our second wave of community. So it'll be those same 1,400 and such participants will come back in, and we'll be able to look and see, do we have any increase from time 1 to time 2 in positive antibody results. people can track the study, and we're going to be putting up a dashboard with the results on our website. And if people would like more information about it, if you're a student and want to know if there's opportunities to participate in the research itself, please feel free to email us at the email address there. And we'll get back with you on sort of current openings and opportunities.
And for listeners, it's data, the number 4 action, data for action at psu.edu.
Yeah, Meg, thank you so much for sharing that data with us. Has anything surprised you guys so far, at least through the research that you both revealed here and in general, some research that you are allowed to reveal at this point? Has anything surprised you at all, or were you guys pretty blank in terms of expectations coming into this?
I think people had a pretty solid guess that State College had a low prevalence rate of antibodies. And I think just confirming that, I mean, I think that was a hypothesis, but we needed to actually do the experiment to test that. Just at a more global level, I think, we are a very large and growing group of people who have never worked together before. And I think there was some anxiety about workflow and how things were going to shape up. And I think all of us have been pleasantly surprised and are working really quite effectively and very productively together. So it's exciting from a, new collaboration standpoint.
Yeah. And just to add to that, on a data side, on the social behavioral data side, I was surprised at how many community residents reported this life disruption, considering that we started data collection in June. But just a couple of other numbers, that 32% said their lives have been significantly disruptive, with another 64% saying moderately disruptive. So I think that surprised me a bit, because we always sort of think about the community as being fairly resilient and, pretty stable. But this pandemic has really turned people's lives upside down. And to see those numbers, I think was a bit shocking for me. On the workflow side, I don't know if it's surprised, but just really, really happy to see how many people that have both signed up for the study as participants, as well as students who have contacted us and said, Connie, sort of what you alluded to earlier, that I want to do something. I want to do something to positively impact, or have some positive impact in the middle of this, sort of terrible crisis. So a lot of the participants that come in anecdotally, we heard, said, I really want to just provide anything I can, data that will help inform the community and help keep the community safe. And for students, it's the same sort of altruistic sort of motivation, just anything I could do to help or be a positive force in the middle of all of this, I want to try to do. So I'm surprised about that. And then again, I just can't say enough about our nurses, our clinical staff, and the people working in the labs. They were literally working around the clock to get these data collected, because it's a small window that we have to really get these numbers. So I'm really happy about that.
Yeah, I do think it's very, inspiring and wholesome that, during this crisis, all these different factions of this, gigantic university have come together and all have a hand in this project, and it seems to be, going pretty smoothly.
Mm-hmm. Yeah, we had faculty who were retired but still had their clearances. They were emeritus status, come in and volunteer in the labs. We had faculty not related necessarily directly to the project come in and volunteer in the clinic to consent and get trained and all of that. So it's just, like I said, a cast of thousands, but it's been terrific to see how people pulled together to make this happen. And we should also mention that the provost, that Nick Jones, that Penn State has funded this entire effort. It is not an insignificant amount of resources that went into this, again, to make that commitment to keep this community as safe as possible through science. It is, I think, just not surprising, but just something that we're very proud of and happy about. So.
Absolutely. And in a minute here, we're going to take a look for those watching on video. We're going to have a look at what some of this looks like. The Huck team went down and took some photos and video of those nurses you were just talking about, and in Connie's lab, seeing some of the students working with the samples. But before we get into that, and I'm going to ask Connie to let us know what we're looking at there and describe that for people listening. But I just want to unpack a little bit the reasons for studying the students separately from Center County residents, those two separate cohorts, and what's the relationship that you're looking for between those two groups?
Yeah, so we're considering this, one study that has two cohorts in it. For the most part, it's a timing issue of when we bring people through the clinic, and trying to get the resident population in first to see, are we truly a naive population? Or is that, we didn't know until we got that 2% that, yeah, we didn't have a lot of transmission prior. That was really critical. So for the most part, we're not really considering them two separate components. It's just a matter of when we stagger the clinic visits and the recruitment process. Now, in the resident cohort, we do have some Penn State students. So the eligibility criteria to participate as a resident was that you were residing in Center County from March of 2020 through to September 2020. But we will have some students in that cohort. They weren't excluded.
Got it.
Yeah.
But will you be looking at the relationships in any way, or is there anything built into sort of the way that the student population relates to the Center County, the town gown dynamic and all that stuff?
Sure. Yeah. So of course we'll be looking at the serology and looking at the level of antibodies, et cetera. But just even on the survey side, we've actually put the same sort of items or some of the same items on the student survey as we did the community survey, and we'll combine those data, particularly when we're looking at vaccine intentions, mitigation behaviors. We want to look at all of the adults that are in our community, not seeing them as separate, realizing that prevention requires everybody to sort of collectively do their part. So we'll be combining those data once we have them for both the community residents and the students.
Got it. And so even though we might be a naive population in terms of low serology results, we hope we won't be naive in terms of how we're living our lives.
Right. Yeah.
Right. And the other thing I wanted to add is we're also collecting health data, other health parameters, because we've learned, unfortunately, there are risk factors that make response to the virus and clearing the virus and illness related to that. And we don't know if those same factors influence a person's ability to make effective antibodies to the virus. So we're collecting that data in both the community sample and in the students. So I think that's another layer of this. And then we have all of the questionnaire data about psychosocial health, and we're going to be able to look at these complex relationships in a very unique way that we feel pretty excited about, because not a lot of folks have had the wherewithal to put a study like this together, grassroots, and get it launched. So I think we're going to have some really, really informative information for not only Penn State community, but the U.S. at large.
That's terrific.
Be a model moving forward, not to end, but to become a system where we're monitoring the health and well-being, because this won't be the last health crisis or infectious disease that we see, sort of coming our way. So we'd love to sort of establish this as a model for other university towns, for other towns that have populations that moving out. So you could see beach towns, resort towns, border towns, military towns with military bases. This has a broader set of implications.
Yeah, and Meg, you mentioned earlier about how the students came back in August from all over the country and all over the world. Basically, some came from high frequency areas and some came from low frequency areas. What impact do you think that kind of dynamic is going to have on your results moving forward?
Yeah, exactly. That's part of what we're trying to study. That's an empirical question. We're stratifying the sample for those who are interested. That means we're sort of grouping students by the prevalence of the counties that they came from before they returned to campus, and then sampling within there. So we're getting a mix of that risk strata. So we really do want to understand, because a lot of them might not know that they were exposed. In the younger population, there is a higher prevalence of asymptomatic spread, as we know. So just sort of understanding that, and then understanding how the changes in the student population and the changes in the resident population sort of move together or diverge, I think is something that would be really interesting. And because we've never been in this situation before, we don't have the answer yet, but that's definitely the question that we're asking.
Right on. Well, if it's okay, I'm going to share my screen and just take a look at some of this footage, and I'll ask Connie to kind of narrate, if she would, because some of this is from her lab. So I'm just going to kind of hit play. This is what it looks like when you come in to give your biological samples at the Clinical Research Center on campus.
Yes, so a nurse is, after consenting the person and they agree to be in research, a nurse would draw blood and then label the tube with the study participant ID. All the data is de-identified, and then it's properly packaged. Here we're taking in a lock of hair for another research study, and all the biological specimens are being placed in the refrigerator. And here's our clinical team after a long, hard day. The blood then gets sent to my lab, and James McGee, a grad student, is loading the centrifuge because we're spinning the cells to separate the plasma or the liquid portion of the blood from the packed red cells. He's entering data here on the computer. So we are archiving samples for future research. Another graduate student, Jan Damani, is pipetting off the liquid portion of the blood or the serum into vials, and those vials would then be assayed for antibodies, and we have some samples biobanked in case any other research questions emerge that we want to address.
Fantastic. Thanks, Connie. And then
Sure.
Those samples are then sent to Mount Nittany, correct? We also have Mount Nittany as a partner in this research.
Yes, we've been fortunate. Mount Nittany has a certified laboratory that is able to evaluate antibodies, and those antibody results are then given back to participants. And so Mount Nittany has been running all the samples since August 7th for us. So we have established a partnership with our local community hospital as well, which is, another part of this team.
Yeah, truly. It's really an example of a community coming together within Penn State and without Penn State. Everybody kind of banding together to do what we can here. Really inspiring stuff.
And I don't know if I mentioned this, but individual participants will get their antibody results back. So, I presented the data that were in aggregate, but that's why the Mount Nittany partnership is so critical, because they have the clinical lab that can actually provide results back. So, so it's unusual sometimes in research studies, if you're participating as, just sort of a resident or a student, you don't get any direct information back, but in this case you do.
That's right. Yeah, that's key in some ways, because I know a lot of folks are really excited to get those results. My own wife was in this study, and that was one of the things that she really wanted to know. Have I had this and didn't even know it, right?
Yeah, I wanted to ask you guys. It seems like there's almost two parts to this research project, which is sort of this social study and the medical study of it. And we've talked a lot about the medical study so far, like taking of samples and the detection of antibodies in these samples. But how do those two sort of come together? And also what goes into the social aspect of the research?
Yeah. So, and Connie, you can take over, because I know this is really your area, but the one thing that I think is really interesting on combining directly combining the bio with the social is around these ideas of inflammation markers, because they have implications both for disease and also for vaccine activation. And we know that students, again, I keep going back to this, but highly impacted by stress, anxiety, life course changes in academic plans, impacting everybody from first years all the way up to graduating seniors, of course. So how does that show up in the body, right? So we'll have measures of self-report experiences, stress, coping, et cetera, support systems. Do they have peers they can go to? Have they been able to talk to advisors and mentors through all of this? But then, and I'll hand this off to Connie, but then sort of looking at both from the hair, the cortisol that we can get from the hair, as well as the serology, how is that showing up, and what are the implications for health and well-being in the context of inflammation and immunity?
Right. And so I think what Meg already nicely outlined is, each part of this is its own research have, top-notch social science researchers asking these questions just about the effect of the pandemic on, social and behavioral outcomes. And then we're looking at the antibody titers and that change, that seroprevalence over time, and the mixing of students and residents. And so that's its own biological question. And we're collecting information about health, prior disease risk, risky behavior, stress and anxiety. And ultimately, we hopefully will be able to answer very key questions. Do things like chronic psychological stress that one might experience during a pandemic, is that influencing the conversion, the antibody rate? Are other existing conditions in these populations, whether that's obesity or a high BMI or prior cardiovascular risk or, diabetes, how are they impacting the development of antibodies, and does stress play a role in that process? So I think we're going to be able to ask some very integrated questions at that interface of, psychosocial and biological or biomedical outcomes. And again, a very unique opportunity to ask some critically important questions as we move forward.
Also wanted to mention that Dr. Rachel Smith and Dr. Jess Myrick as well as others are looking at health messaging in particular. And so how do we effectively health message around this? So how do we use our own data to potentially feed in health message, into data-driven health messages that might resonate with students, with residents, et cetera, to better manage their overall health, but particularly their COVID-19 behavioral health actions.
Yeah, and I feel like you're all sort of taking this really interesting holistic view of health in general, both mental and physical. Because I know I can speak for myself. If I'm really stressed out for a while, I just feel bad body wise, physically, and I feel like that could even affect how prone somebody might be to catching the virus potentially, and sort of documenting these effects and noticing patterns.
For sure. Yeah. The mind-body connection is a biggie. Well, this has been spectacular. Does anybody have any last questions while we're still on the line together?
Sure. Yeah. If I just want to ask one final question, say if there is a student out there listening right now who is thinking about participating, whether that be helping to conduct the study or, undergoing the study themselves, is there anything else that you guys would like to say to them?
Yeah, well, thank you. First of all, thank you for considering this. Anything that our students, again, can do to sort of help spread the word about the study, that why it's being done and sort of the different aspects would be really helpful. For the student enrollment, we will be emailing students directly sort of in these batches. So please look for an email from Data for Action. And if you're invited, consider clicking through at least to learn more, I think would be something that we would love for students to understand.
And even if you have no history of participating in research, either as a participant or as a volunteer, we have lots of jobs for lots of different kinds of people. So, if you want to make a difference, shoot us an email.
That's at data4action@psu.edu. Well, I just want to thank everybody again for being on the Podward State Symbiotic Podcast Collaborative episode. It's been wonderful talking with you all. I wish you the best of luck with this project, and the best of luck to the Podward State hosts with everything they're doing. And let's just look at this rough situation and realize we can still do positive things to make a difference in the world, to make things a little better for everybody. So we are doing what we can. Thanks a lot, everybody. Take good care.
Thanks again.
Thank you so much.
Thank you guys so much.
Bye-bye.